Hello medicos, let us start with the lecture on fracture healing. Before starting with the lecture, if you are new to my channel, please subscribe to my channel and hit that bell icon so you get notified every time I post a new video. Also, I am repeating this in all of my lectures that if you feel my lectures are slow, go in the settings above, tap the playback speed button. You can increase or decrease the speed as per your need. When you increase the speed of my video, you can have rapid revision of all the topics I am covering. I have been covered till now. Now, we are going to see what all topics I am going to cover in this lecture. The first topic I will be covering is stages of fracture healing. Then we are going to see the difference between the primary and the secondary bone healing. Then the factors affecting bone healing, and at last the MCQ on this topic. Now let us start with the lecture. The fracture healing and the soft tissue healing is similar in many ways, but they differ at some point, and those are the soft tissue heals with fibrosis, whereas the fracture heals with mineralization of the mesenchymal cells. Now, one more point, that the healing of fracture starts as soon as the fracture occurs, and why it is so we are going to see further in this lecture. First of all, let us see the stages of fracture. What? The stages of fracture. So the first stage is stage of hematoma, then we have the stage of granulation tissue, then the callus, then the stage of remodeling. Earlier it was called as stage of consolidation, but now it is called as stage of remodeling, and the last stage, the stage of modeling. Earlier it was called as stage of remodeling. So these are all stages of fracture healing. Now we are going to see all these steps in detail. Let us start with the stage of hematoma. It starts as soon as the fracture occurs, and it lasts up till approximately 7 days, that is 1 week of the fracture. What happens in hematoma in this stage? There is breach in the continuity of bone, periosteum, and the surrounding soft tissues. Because of this, there is leaking of blood in the site of fracture, and hence then we get the formation of hematoma. Because of the hematoma injury, there is ischemia or necrosis of some part of the fracture end, and also there is ischemia of the precursor cells. What is it? There is ischemia of osteocytes. Okay, because of this ischemia, there can occur two things. The first thing which occurs is either the death or there is sensitization. And because of this sensitization, this osteocyte further differentiate between the daughter cells. What are all those daughter cells and what will happen, we are going to see in the next step. Now let us move towards the next step, that is the stage of granulation. This stage lasts for up to 2 to 3 weeks. Okay, what happens in this stage? This sensitized precursor cells will proliferate and differentiate between first the blood vessels, then we have the fibroblast, and then it will differentiate, and again it will differentiate into osteoblast. In this stage, there is formation of soft granulation tissue. There is formation of this soft granulation tissue between these two fractured end, and this granulation soft tissue act as an anchorage for the osteoblast to carry out further mineralization of the bone. But where does this soft granulation tissues or the inflammatory tissues or these blood vessels anchor on? They anchor on the meshwork produced by the clot in the previous step. So this granulation tissue anchor on mesh work of the clot. Okay, and this granulation tissue further acts as anchorage for osteoblast. Right. Because of the inflammatory cells present in this granulation tissue, those are macrophage, macrophage or giant cells. These, what happens here, these cells remove or eventually remove the clot in the previous stage. Okay, now let us move towards the another stage, that is stage of callus. This stage lasts for 4 to 12 weeks approx, or it can be earlier as 3 weeks. What happens is that the precursor cell osteocyte further differentiate to form osteoblasts. This osteoblast, we'll write down over here. This osteoblast further lays down the intercellular matrix, and this intercellular matrix further undergoes impregnation by the calcium salt. There is impregnation by what? By calcium salt. And this intercellular matrix impregnated by calcium is called as callus, which is also called as woven bone. What you call it as? You can call it callus or the woven bone. This callus is a first visible sign of fracture healing on X-ray, seen on X-ray as early as 3 weeks. What is it? It is very important part, and it is most favorite MCQ asked, that is, the callus is the first visible sign of fracture healing on X-ray as early as 3 weeks. This callus formation is faster in cancellous bone as compared to the cortical bone, and it is faster in children's as compared to the adults. Okay, so these are the points we are getting in this stage. Now let us move towards the next stage, that is stage of remodeling. What is the other name for the stage of remodeling? It is the consolidation. What happens in this stage? Okay, first of all, this stage lasts for 1 to 2 years. Okay, approx 1 to 2 years. What happens here is that this woven bone we got in earlier step get converted into the mature bone. The woven bone is converted into mature bone, and the pockets in callus get converted in the pockets in lamellar bone, right? This process is I will write it down in red color, is multicellular unit. Okay, and this can take approximately 1 to 2 years. Now let us move towards the last stage of fracture healing, that is stage of remodelization, and this process can take many years. And what happens in this process? It takes time is many years. What happens in this process? There is strengthening of bone. Because of the weight bearing of the bone, because of the ligaments and muscle attached on the bone, they give constant pull and the pressure over the bone, which causes the strengthening of the bone. This pressure pull is a stimulus for the strengthening of bone. So what happens over here? There is strengthening of bone. And what is the stimulus? Stimulus is weight bearing or attachment of muscles or ligaments, which give rise to the pull. Now, what is the important point in this process is that it is very crucial or conspicuous in children. because there can be the angulation of fracture as if there is improper healing, or there in normal bone also if there is lot of pull or lot of bearing, there can be the angulation of fracture. So it is very conspicuous in children because of what? Angulation might take place in fracture. Okay, now up till now we have seen the healing of the cortical bone. Now let us see the healing of calcinous bone. The healing of calcinous bone and the cortical bone is not different, but there is difference at some stages. Here we get hematoma. See, as from this image you can appreciate the calcinous bone is a spongy bone, that is, it is the calcified form of woven bone. There is no lamellar formation, there is no maturation of the woven bone, there is calcification of woven bone. So hence we can write there is hematoma. From here we get granulation. From here we get the woven bone, that is, we get the callus, but there is no stage of remodeling or the stage of modeling. This woven bone get calcified to form the calcification to form the spongy bone. Okay, so in this way there is the healing of calcinous bone. We have stage of hematoma, we have stage of granulation, we have stage of callus, but there is no stage of remodeling and demodeling. Okay, now let us see the difference between the primary fracture healing and the secondary fracture healing. The primary fracture healing, there is disturbed stage of hematoma. This disturbed stage of hematoma is because of the surgical intervention. We surgically approximate the two ends, the fracture end. Hence, there is no formation of callus, there is direct healing of fracture. There is no formation of callus, there is direct healing of two fracture end. Hence, as there is no formation of callus, there is no sign of union seen on X-ray in this method. But what happens in secondary fracture, we do not interfere the normal healing process. There is no disturbance in stage of hematoma. Hence, we get callus over there. So, we get callus, so we can see the sign of union on X-ray, right? And the secondary healing, the secondary fracture healing is seen in mere immobilization of the fracture. There is no surgical intervention seen is there in secondary fracture healing. Now let us move towards the last part of this lecture, and after that we are going to see the MCQ. The last part is the factors affecting the fracture healing. So the first factor we are going to see is age. The fracture healing is more faster in children as compared to adults. They are 2 times faster than adult. Okay, you can see the callus in the half time on the X-ray in children as compared to the adult. Even the type of bone matters in the speed of fracture healing. The fracture healing is faster in flat and calcaneous bone as compared to the tubular or cortical bone. The pattern of fracture also affects the speed of healing. The healing of fracture is fastest in spiral fracture. It is bit slower in oblique fracture and bit slower in transverse fracture. So this is the order of the fracture healing. The first one we have the spiral, then bit slower in oblique, and then bit slower in transverse. It is slowest in commuted or the polytrauma fracture, where there is either the commuted fracture or we get the open fracture. It holds the slowest. Then the distributed pathoanatomy. What factors affects over here is that the surrounding tissue, the involvement of surrounding tissue in the fracture. If there is surrounding tissue penetrating, or there is presence of surrounding tissue in the two fracture end, there is improper formation of callus or non-formation of callus. So the fracture end should be approximated, and there should be no surrounding tissue between the fracture end. There should be proper formation of callus, which occurs only when there is nothing between the two fracture end. Okay. Now there is type of reduction. When in adults, the fracture end should be in close contact with each other. If it's okay, only the half part of fracture end is in contact, half part is enough, half section is enough, it should be in contact. But what happens in children, even the fracture end is on side by side, there is formation of callus and there is healing of fracture, and this is called as bayonet reduction. Can you see a word over here? This is because of side to side healing of fracture. It is seen in children. Hence proper reduction in angle, plane and the vertical line should take place for the proper healing of fracture. Then the immobilization. Some bones like ribs or scapula, if not immobilized, then also they will heal. But the fracture of long bones, that head of femur or the tibia, they need to be immobilized properly for the proper healing. And the open fracture is the slowest in healing. If we clean the fracture properly and there is proper approximation, then it will heal, but it is the slowest to heal. And the compression at the fracture site. The compression at the fracture site of calcinous bone increases the speed of the healing of fracture. Now let us move towards the MCQ over here. The first question is, when does the fracture healing start? The second sentence of this lecture, when does the healing of fracture start? It starts soon after the fracture. Not after 1 hour, not after 1 week, not after 2 weeks. The first stage of fracture healing is hematoma, and as soon as there is fracture, there is breaking of vessel, there is hematoma. Hence the answer for this is A. Now the sensitization of precursor cells happen in, yes, it is stage of hematoma. There is death of some osteocytes and sensitization of some osteocytes. So the answer for here is A. Then the next question, in which step first sign of union is visible on X-ray? What is the first sign of union visible on the X-ray? It is callus. It is seen in stage of callus, and it occurs as soon as 3 weeks after the fracture. So the answer for this is stage of callus. Answer is C. As soon as 3 weeks. Right? Now, the woven bone is replaced by mature bone in which stage? The woven bone is differentiated into or replaced by the mature bone in the stage of remodeling. It is seen in stage of remodeling. So the answer is D. The strengthening of bone occurs in which stage? What are the stimulus for the strengthening of bone? It is the pull or the pressure weight bearing applied on the bone, and it occurs in the last stage of bone healing fracture. That is, the answer is stage of remodeling. So the answer is D. Next question, which stage is absent in healing of calcinous bone? Let us enumerate first. What are the stages present in healing of the fracture? Stage of hematoma, stage of granulation, stage of callus, but there is no stage of remodeling and modeling. So the answer for this question is stage of remodeling. Right? Now let us move towards the last question of this video. Which of the following is false and here I have enumerated, we are going to see the factors affecting the bone healing. The first is fracture healing is 2 times faster in children than adults. Yeah, it is faster. The answer is, this sentence is right. The flat bone and the calcaneous bone heals faster as compared to the typical tubular and cortical bone. The second fact, second point, types of bone, yes, it is right. The calcaneous and the flat bone heals faster as compared to the tubular and the cortical bone. Right? The order of healing is transverse, oblique, and spiral. Wrong. The type of or pattern of fracture, spiral heals the fastest, then is the oblique, and then is the transverse. So this is the wrong option. The ischemic ends show delay or non-union. Right? The ischemic end shows delay and non-union. It's the correct. So the answer for this question is C. Sorry, I'm so sorry. The answer for this question is D. So here we are done with the fracture healing. The next video is on the how will you going to manage the fracture, and it is the last video on the fracture. So stay tuned on to my channel, and if you are still new to my channel, please subscribe to my channel and hit that notification button so you get notified every time I post a new video. Also smash that like button or thumbs up button if you like my video, and comment